East Coast, 1 o'clock out on the West Coast. Big story of the day, obviously, CDC announcing the new guidelines there. It seems like now we are taking steps back in the COVID-19 fight. Now masks are back on. We want to get some updates here and really some guidance of our own right now. So that's why we bring in Dr. Nicole Saphier, Fox News medical correspondent with the very latest. Thank you, Dr. Nicole. First off, what are your thoughts on this?
Well, it wasn't unexpected. I'll be honest and tell you that. I do think that, unfortunately, putting forth some of these vague recommendations about starting to wear masks again, vaccinated or not, does contribute a bit to vaccine hesitancy. But as you can see, there are areas in our country where you are having rising cases of new cases. You're also having rising vaccines. So what are we going to, rising hospitalizations. So what are we going to do in these areas? And, the go-to right now is to do mask mandates. Whether or not that's actually going to do anything, I'm not sure. But we can tell you when it comes to the vaccines, they are still very good at preventing severe illness, specifically in those who are at high risk. So I would still encourage everyone to go out and get vaccinated who wants to, who doesn't have a contraindication. But at the end of the day, there are certain people who maybe should be wearing masks again, those who are immunocompromised, those who are over the age of 65, vaccinated or not. As we see, about 75% of the severe breakthrough infections are in those people who are over 65 years of age. I do not think universal mask mandates are the way to go at this point.
And maybe help our viewers out here, because months and months for now, the White House has really been pushing for people to get vaccinated. So much so, it seemed like every week we were getting updates on the percentage of people getting vaccinated. Now it seems like if you're on the edge and maybe contemplating it still about getting the vaccine, maybe you wouldn't now, because what's the point, really?
Well, so that's a very good question. So my concern is, by saying that vaccinated or not, everyone's going to need to wear a mask if you are in an area where there's higher transmission. And while I do think that high-grade medical mask wearing is warranted in those who are vulnerable, those who are over 65, even if they're vaccinated, and those who are immunosuppressed, if you are in tight, indoor, crowded areas where you're around a lot of people and there could be a good amount of virus circulating, yes, I actually think that those people should be masking up. But I think for the general population, even if there are in areas where the transmission is high, I think that for the majority of the people who are vaccinated, they are still going to be protected from severe illness and hospitalization. We have to stop looking at the new cases and really should just be focusing on hospitalization, because unfortunately, our testing is not uniform. We have some states that are testing a lot of asymptomatic people who have been vaccinated, and whether or not those are clinically significant infections and leading to increased transmission, I would say probably not. So unfortunately, I do think that our data is a little muddied, and we should really be going by hospitalizations. And when you look around the country, even in the states that have some of the highest cases right now, Florida, Missouri, and other areas of the Sun Belt, their 7-day average of deaths and even hospitalizations are still much lower than we have seen throughout the course of this pandemic. We have to start putting COVID-19 in an area of risk versus benefit. We have been okay with certain levels of risk when it comes to many other things, certain bad flu seasons, certain respiratory viruses in children, car accidents, even accidental drownings. You have more people dying of more children who die of accidental drownings than COVID-19, yet we haven't shut down pools.
Very, very good point. And what about alcohol? What about tobacco and all that as well? That is still freely available, and everyone has issues with that as well. And then, Doctor, can you also talk about the CDC talking about masks for kindergarten to all the way senior and high school?
So listen, I'm a physician, I'm a mother of 3, so I have many different opinions on this, and it's all about risk benefit here. And while, there are some children, albeit extremely rare, have had severe outcomes from COVID-19, it does appear that it is very rare. Less than 500 children out of probably over 10 million that have been infected with SARS-CoV-2 have had a severe outcome, whereas you have over almost twice that much who die of, say, RSV and other respiratory illness every single year. And as I mentioned, drownings and car accidents. I think that the risk of wearing masks every day, especially for the younger children, less than 12 years old, I think it really does impede on their social development, their ability to have facial recognition. They can have some dentition problems. They can have some anxiety. I think the risk of those consequences of mask wearing really doesn't outweigh the benefits of children wearing masks. We have seen in multiple studies that when you're looking at school transmission, it isn't necessarily the young children having in-school transmission, it was the adults. Now, those studies were done before vaccines were available. So now that the adults have the opportunity to be vaccinated, the chance of transmission inside of schools really approaches zero. And as we know, severe outcomes regarding hospitalization and deaths in healthy children also approaches zero. So really, what are we trying to do by masking children at this point?
Absolutely. And another thing to really ask about, too, a lot of people might be looking at this one where earlier in that announcement, the CDC did say about talking about color-coded areas of the U.S. that are going to be maybe in a different zone than, say, a different city out west or east or vice versa. But how does that even match up? I mean, is it one day, hey, you got to wear a mask, and then a week later, maybe not if you're in the right color code?
Well, so that's the big question. I mean, unfortunately, the local townships are going to have a real issue about going back and forth. And so what they're going to need, they're essentially not even going to do this based on community transmission. What they're going to do is just do a blanket response, say, you know what, forget it. Kids are just wearing masks all school year long. That doesn't, and unfortunately, when you do that, because it's too hard to wax and wane based on community transmission and to wax and wane based on the ever-changing CDC recommendations, you're going to have children wearing masks when it's probably unnecessary, but that is because we have had such inconsistent messaging.
Yeah, it just seems like a back and forth right now. And lastly, Dr. Nicole, a lot of people might be saying this, that hey, they did it once before with lockdowns, shutdowns, mask mandates. This seems like it's just really easy for them to pull it on back. What happens if they never take it the other way again?
That's a really good point. So you have to remember a year ago when mask mandates were going out, we had no mode of protection against this virus. We didn't have a vaccine, we didn't have proven treatments, and we certainly didn't have over 2/3 of the population with some form of immunity. We're in a very different place than we are right now. And it's important to remember that. And yes, while you see these cases rising, you're not seeing the parallel rise in hospitalizations and deaths. Yes, you are seeing a bump in hospitalizations because this Delta variant is extremely contagious, and it is actually causing a higher viral load in people. However, as it has been reported, over 99% of the people who are dying from COVID-19 right now are unvaccinated. I wish that they would report how many of those people also didn't have a history of a COVID-19 infection, because I think it is very disappointing that they are continuing to not acknowledge natural immunity at this point. But I actually think as a country, we're doing much better as a whole than the media headlines would make you think. There are pockets of the country that have low vaccination rates, low immunity rates, and they are going to see a bump in COVID cases. But again, we are not going to get to the same place as we have been during the first and second wave with hospitalizations and deaths, because over 90% of those 65 years and older have at least one dose of the vaccine. We have a staggering amount of immunity happening all across our nation. Yes, we want to make sure people are still going out and getting the vaccine. Those who have gotten the first dose go and get that second dose. But the good news is we have a high level of community immunity. So we need to actually become more uniform in how we are testing and reporting of new cases, because I can tell you that I actually don't think that we are in as bad of a position as the media headlines would make you think.
Yeah, I just don't know where this all came from this week, because if you think about just 2 weeks ago, 3 weeks ago, I mean, in the media, we were being told, hey, let's go to other topics. Let's try to find different stories. You know, COVID-19 is coming on the downtrend, and then, you know, starting this week, you sort of saw something happen yesterday when some of these cities, like even states like California, Governor Gavin Newsom, begin to talk about COVID-19 again and maybe talk about masks. I mean, how did this all, I mean, just a month ago, they said, hey, Vegas is back, everyone's back.
Well, it's upsetting. It's upsetting to say the least, because if you would just take a snapshot of what's going on in the media, you would think that this Delta variant has its grip on the United States and we're in a terrible position. But if you actually look at it, right now, on average, you have about 220 people dying of COVID-19 a day. Well, obviously, any death is tragic. 220 deaths a day is what we have deemed acceptable previously in bad flu season. We also have more people dying of cardiovascular disease, cancer, opioid epidemic, drug overdoses than COVID-19. So while it makes for a really good headline, we actually have a lot of other things going on in our country causing a lot more disability and death every single day. But again, you know, that's the name of my book, Panic Attack, because these make for really good media headlines. Now, that's not downplaying the significance and importance of the Delta variant. Sure, it is more contagious. It causes a higher viral load, which means it can send more people to the hospital, and we are seeing some breakthrough vaccine cases. But if you are vaccinated and an otherwise healthy individual, the chance of you having a severe outcome of COVID-19 or you giving it to someone else really is about nil. But for those people who are over 65 who are immunosuppressed, then in that case, yes, I would consider maybe changing your lifestyle a little bit to, again, further decrease your risk, however best you can, because it's possible booster shots will be in your future.
Dr. Nicole Saphier, thank you so much for always giving us really the insight and really the context, maybe really behind this whole pandemic. We truly always appreciate it. And thank you so much for your time. Have a great day. We appreciate it.
Thanks so much for having me.
Yep, no problem. And we continue on with more news from across the country right here on Live Now from Fox after this 2-minute break.